what is deep vein thrombosis and what are the treatment options?
Deep vein thrombosis. So, is if you want to say in a lay language, it is nothing but a clot formation in the venous system. So that specifically to the deep venous system. So generally, deep vein thrombosis occurs most commonly in the lower extremity. It can be anywhere in the deep veins from the iliofemoral, from the IVC to iliofemoral and the femoral popliteal till the legs. So whenever the patient, even if after anticoagulation still is having the symptoms, then they will be referred to the interventional radiology department. So we evaluate and we have, so there are multiple treatment options. What is the main thing is catheter-directed thrombolysis. So in this we place a catheter in the vein and we inject the thrombolytics, and later we remove the catheter and then we check for the flow of the vein, and it will be so that how we look for the patency of the vein. So this is the initial one. Now the latest what we are doing is a pharmacomechanical thrombectomy. So we have multiple devices available in the market. So in this main is what we have is the aspirations, like angiojet aspiration. What is there? This what does angiojet does is it actually initially thrombolysis is done and thrombosis aspirated after some time. Then later we have cleaner XT. So this is mainly it lyses the thrombus, and later we do a manual aspiration thrombus, and finally we have a penumbra suction device, so where the entire thrombus is sucked out. So these are the major treatment modalities. So the main advantage of early management is if you want a better result and to avoid the post-thrombotic syndrome, early treatment is the first option.
What are the common symptoms of deep vein thrombosis and how is it diagnosed?
Deep vein thrombosis can be seen in any age group from say 15 to 75 years of age group. So if at all a patient, whenever the patient presents the sudden onset of pain in the calf with sudden onset of swelling. So these are the initial symptoms. So nowadays they generally neglect these type of symptoms. But if you neglect, and within a week the patient will develop swelling. So the swelling with entire swelling of the entire limb will be there. Sometimes there will be discoloration of the skin, and some redness will be there, and majority will be a tender touch. So these are the major symptoms: fever, associated fever, then with severe pain. Sometimes there will be skin erosions also can be seen. So but the foremost major symptoms are swelling with pain. It can be unilateral, it might be aligned to a single leg, or it can be bilateral. So accordingly the treatment differs. So what is the next question? So once a patient presents to the hospital with acute deep vein thrombosis, means like with a swelling of pain, so the initial diagnosis.
Who are the eligible patients for medical intervention?
Initial diagnosis is the cheapest modality what is available is ultrasound. So the moment the patient comes to an ER, just put a probe, ultrasound probe, get the radiologist and do an ultrasound scan of the lower limb, look for the vein. Even if it doesn't have a color Doppler, you just look for the compressibility. So if it is non-compressible and put a color in, there's no flow seen within the deep veins. So that's how we diagnose the deep vein thrombosis. If all you're planning for any intervention, definitely we do a CT venogram in a later stage just before intervention. We have to evaluate what is the time frame of onset. So any patient within 2 weeks of deep vein thrombosis have a better result when you do any intervention.
What is your clinical experience on the results and present literature review for this procedure?
Relieving the patient's symptoms immediately after doing an intervention, within 24 to 48 hours, the patient, his or her swelling is completely getting reduced, and the pain, the tenderness, and the majority is post-thrombotic syndrome. So we are able to avoid this post-thrombotic syndrome. So either by, for example, if you say in the left DVT, by placing stent, and long-term patent, by maintaining the long-term patency of the vessels. So it's been clear in the literature.
What is your message to the general physicians about managing these patients in their OPD settings post-procedure?
I recommend all the physicians who see the patients post-leave, so just look for the post-thrombotic syndromes. So what is post-thrombotic syndrome? Post-thrombotic syndrome, what happens is there will be an again increase in the swelling with the recurrence of thrombus and pain. So these things will be very commonly seen, And at the same time, the patient is already on anticoagulation. So look for signs of bleeding. So these two are the main things I recommend all the physicians. Please refer the patient in an early phase of less than 2 weeks, so that we can give a better result and give long-term results without by avoiding post-thrombotic syndromes and lifestyle management.